Hi everyone, I'm Jen, this is Moose, and today we're going to talk about Moose's gastropexy surgery. So a few weeks ago, Moose had an abdominal surgery called a gastropexy, and a gastropexy is where they tack the stomach to the abdominal wall to help prevent the risk of bloat. So bloat is a condition that giant breeds can get, any dog can get, but giant breeds are much higher risk of getting. And that's where their stomach will twist or flip and they have a buildup of abdominal gases and it can be quite fatal. So you can do a preventative surgery for it. So when we did our surgery, we had no idea what to expect in terms of recovery. So what our vet told us is we were to keep him chill for 2 weeks. So we actually had to sedate him for some of that time because he was so busy and crazy. The first 5 days we weren't allowed to sedate him because of the medication he was on because of his gastropexy. But then after that we could sedate him. And he was to wear his little bodysuit for the full 2 weeks. For the first 5 days, they actually said we had to reduce his food intake more than normal. So we were feeding him 4 to 5 times a day just because the stomach was involved. And we tried not to let him drink large quantities of water at once, which is tough to do because Moose is one of those dogs that just chugs water. And that is kind of the summary of our gastropexy recovery. We had a couple complications. Moose had some airway complications about a week into it, and he started retching. So we took him to the emergency vet. That was all resolved. We think it might have been some irritation from the trach tube or from something he got into his trachea. But other than that, he did really well. And we did it at the same time as his neutering, just because they were going in anyways. So only one surgery, only one recovery, which was kind of nice. So we waited till he was 21 months old to do the gastropexy, and now we feel a lot more confident with him moving forward with less concerns that he might potentially bloat and have higher mortality rate. So thanks for tuning in today to learn a little bit about the gastropexy that Moose had. Again, I'm not a vet tech, so for any solid information, please talk to your animal care provider, and we will see you in again next week to talk more things Danish.